We'll start with Rob Field.
Okay. I want to talk about three areas related to health reform and some issues that I think have been overlooked and might attract interest. One is what's happening in the market, the other is the political situation, and the third is the legal situation with the court challenges. So in the market, I strongly recommend to anyone who has not seen it Monday's article in the Wall Street Journal about the changing healthcare industry, about integration in healthcare, about how doctors are working more as employees and getting incentive payments. Hospitals are going into accountable care organizations and other kinds of integration strategies, and insurers are going into actually providing health care. I think that shows what's happening beneath the surface that people aren't really seeing. I think, several decades ago, the idea of the solo practitioner, the Marcus Welby, ended, and we still haven't quite acknowledged that. It's impossible to get quality health care from someone who's practicing in isolation. And all of these secular trends over decades, we've seen peaks in the 80s and the 90s and today, regardless of what's happening politically with health reform and so forth. So what does that mean in Philadelphia, New Jersey? The health reform law promotes what's called accountable care organizations. I'm not going to try to describe them. I'm not sure if I even could. The idea is to create coordinated incentives for more efficient care, and that can be keyed off of anyone, a hospital, a doctor, an insurance company, an investor. And if they are able to be more efficient, Medicare pays a bonus, and then they share that with their members. There hasn't been as much activity in this area as in some other parts of the country. There seems to have been more in New Jersey than in Pennsylvania. Atlantic Care and ARIA Healthcare have announced that they're starting them. I'm not aware of many, maybe you guys know of others, I'm not aware of any major efforts in Philadelphia. On the other hand, Philadelphia saw major consolidation integration in the 1990s, and I think part of what may be going on is it's still digesting that, and it still has a level of integration that's sufficient so that it doesn't need to go to the same step. Some of the markets that aren't as well developed may be taking advantage of this new paradigm to a greater extent. Within that, one of the speculations is that we'll be seeing other different kinds of providers, for instance, more urgent care centers to replace emergency rooms because people will have insurance to cover that care and they can get treated quickly rather than waiting around in the ERs. In terms of insurers, Independence Blue Cross has been extremely active in trying to develop incentive programs for doctors and hospitals to reward quality and efficiency. And I think because they have such a dominant market share, perhaps more so than insurers in other parts of the country. So it'll be interesting to see how Philadelphia compares to even New Jersey, where it doesn't have as concentrated a market in terms of the role of the payers. Employers here as elsewhere are beginning to look at wellness programs to provide incentives, lower insurance premiums, bonuses or whatever to employees who meet health targets and who go to health clubs and so forth. That's just beginning. There's a lot of controversy around it. The Wall Street Journal article talks about that in terms of the intrusiveness of it. It's for your own good, but there's this paternalism, which is more than we've ever seen from employers. So what's that doing to employer-employee relationships? And then the consumer side of it, there was a news story today that Department of Health and Human Services says that about 2.5 million young people, 19 to 25-year-olds, are taking advantage of the ability to go back on their parents' policies. So apparently that has been quite successful. Some questions I would love to see. What happens when they get to be 26? Are companies allowing them to stay on, or are they getting kicked off, back into the wilderness as they had been? Are they changing their pricing? Are they now pricing premiums per dependent as opposed to a family with children in order to recoup more money from these young people? There is a reason to believe it actually will lower their health care costs for the same reason that the mandate will, because you're bringing younger, healthier people into the risk pool. So if you spread that out around everyone, it actually shouldn't theoretically be a burden, but how is that playing out? Are companies doing this willingly, or are there barriers? And also what's happening to people who would have hit coverage limits and had policies rescinded. In terms of the politics, there's a point that I think gets lost in the partisan Democrat versus Republican debates, and how all the Republican candidates said that the millisecond they're in office, they'll repeal it. There's the business community. And the reason this thing was passed is that insurers, pharmaceutical companies, hospitals lobbied very hard. They were either on board or they lobbied for it because they saw business opportunities. It's interesting, the parallels to Medicare. That's one of the ways Johnson got Medicare passed, and that's one of the reasons we can't make major cuts in Medicare, because it's not just the beneficiaries, it's the businesses that lose out. So they're not going to be very happy if this got repealed. And about 6 months to a year ago, there were some stories about how they're beginning to lobby to keep it in place. My guess is that if it's purely a political question, they would keep major pieces of it going. But that's something that hasn't really been explored very well. There also have constituencies for maintaining the exchanges in the states like Pennsylvania and New Jersey that are going to have them. So even if we don't have Obamacare as an entity, we would still have the capacity to have exchanges that served some role and got more people into the insurance market. And my guess is they would want that to continue. Legally, in terms of the Supreme Court case, there's a way I look at this that I haven't seen a lot of talk about, which is the different scenarios. There are 4 moving pieces here, 4 different issues that the Supreme Court is going to decide. And just very briefly, if the mandate is ruled unconstitutional and everything else is severed from that and allowed to stay in place, there are dire predictions that means the insurance market will collapse, that they won't be able to support the new open underwriting if the young, healthy people can't join in. And how unlikely it is that Congress will come up with a patch because of the partisan disputes. That may not necessarily be the case. It may be the case that something could come of it, and those alternatives I don't think have been explored that thoroughly. But there are some other alternative scenarios that I think are even more likely. If the insurance provisions go, but everything else is severed from the bill, would local business communities want to try to keep exchanges? Utah, which is a very conservative state, has an insurance exchange, and apparently it's serving a purpose. The Medicaid expansion, if that were to be struck down by the court, that's half the people who are going to be covered by the law. That means half the law's effectiveness is thrown out. And can the market reforms carry enough of a change to be meaningful? If all of the law goes, there's potential chaos in a lot of ways that people don't even see. If you look at the Kaiser summary of the law that's in the materials, there's legislation on generic copies of bioengineered drugs. There's provisions on student loans, on quality reporting, on accountable care organizations, nonprofit reporting for hospitals, on the Medicare donut hole, and on and on. Does all of that suddenly go out? That could really be a chaotic situation, and those have nothing to do with the rest of the law. So I think looking at those scenarios and what they mean would be quite interesting, and talking to the players. A final thought is, if you want to see what these exchanges look like, there are 2 of them in existence, and if you haven't already, I strongly recommend you go to masshealthconnector.org and act like you're a consumer and see where you get, or go to exchange.utah.gov, which is a very different kind of exchange, but it gives a picture of what states can do on their own.